Disabilities Issues and Updates on BCTV is supported by the Berks County Center for Independent Living, Abilities in Motion.
And welcome to Disabilities Issues and Updates. I am Teresa Faulkner, your host. Today our topic is going to be, guess what, COVID information. And our guest is Dr. Mary Kelleher, who is a doctor of medicine and also has her master's of public health. She works at Berks Community Health Center, which is located in Reading, Pennsylvania. And again, our information is, we thought this was going to be over by now, COVID information. Dr. Kelleher, thank you so much for being a part of our show today. Why don't you tell the audience a little bit about yourself and what you enjoy and how you love this COVID information?
Hi, thank you for having me. I'm Dr. Mary Kelleher. I've been a practicing family physician, as can be exhibited by the gray hairs, for over 25 years now. I also obtained my master's in public health while I was in medical school and have really been committed my whole career to providing primary care and looking and taking care of the underserved population, both here and previously in Baltimore and New York. So I've had a career of being a family doc first and foremost, and then also always trained to kind of look at the big picture of public health and making sure that we're taking care of the communities that we serve.
Thank you so much. And public health and this COVID is a real big issue at this current time. We have received some questions, and so we're going to jump right in and talk about just some basic information about COVID. And then Dr. Kelleher is going to actually go into some statistics here in Berks County. Let's just start with the first question. How does a person get tested for COVID-19?
There's a couple of ways to get tested. Initially, there was a real lack of access for testing, so people really struggled to get testing. In the national news and local news, there were lines of people, finding a way to get tested to try to get access to a test. That has improved since, now going on almost 2 years. So you can still go to locations to get tested. You can go to doctor's offices. You can go to urgent care. There were some public testing sites available. But now one of the newest options was really the government made a commitment to try to get people to get at-home testing so that they could test themselves at home and be able to know very quickly whether they're negative or positive. So there have been ways to sign up, and some people have still not done that. I did that myself as a family. Went for covidtest.org and get tests mailed, and you get them in the mail. So you get them in the public mail. And you'll get up to 4 test kits, and there's even been attempts to increase that amount. So there was another opportunity to sign up for even more test kits so people could have them in their home to test themselves at home without having to leave their homes to get tested.
Now, do you have any statistics in reference to how that testing at home process is going within our community?
I think that's a big unknown. That when different organizations and healthcare institutions test, there was a requirement to report the test and labs to report the test. But at-home testing, there really is no reporting requirement. So how many people are doing tests and what the results of those tests are not really collected. What we do know is that in the past, there were millions of tests being done every day in the country as a whole, and that number has gone down tremendously. Whether or not that number reflects the at-home test, I think is definitely an issue to be concerned of because people are just not reporting those at-home tests that they're doing.
Okay, gotcha. Now, I know that there are symptoms to COVID-19, but one of them are you lose your sense of smell. If that happens, does that warrant a call to your primary doctor?
Yeah, I think initially there have been a couple of strains of COVID since the beginning. So the initial strain of COVID, which was the Delta strain, that was really much synonymous with COVID. So if you had upper respiratory symptoms and you woke up and said, I can't smell or taste, we as healthcare providers are like, oh my God, this is COVID. You know, there's not too many things that cause a sudden loss of taste and smell. So I would say that if you have that as an acute symptom, something brand new, COVID is still in the things to be considered. What's important though is with this new strain that has kind of developed, that's not as common. Still seen, but not as common as an original strain. So if you're unsure, I recommend you can do a home test or go to your PCP or your primary care physician to get tested. But you don't necessarily have to panic. It really is in the setting of what other symptoms are you having where you have to get tested or how quickly you would have to get tested.
So is it that you have one symptom or you can have multiple symptoms with COVID-19?
Yeah, I think that's somewhat the unfairness of this disease, so that you have a lot of people who are walking around who had no symptoms. In fact, if you tell them they're COVID positive, they look at you like, you're kidding me, I can't be COVID positive.
Really?
And then you have people who end up in the ICU on ventilators and on the extreme end have died from the disease. And really what we try to do is try to see who's at risk for the most serious complications, who is at risk for mild. But I can tell you we've seen the spectrum. So we've seen very chronically ill people with very mild symptoms, and then we've seen pretty healthy people who have ended up in the ICU or hospitalization. That has to be my plug for vaccination, because what we have found is people who are vaccinated and boosted are more likely to be on that spectrum of being less symptomatic should they be exposed to COVID.
So the vaccine and the booster kind of help with the symptoms altogether?
Absolutely. You can still get symptoms, but they tend to be more mild, and it definitely has been shown to decrease the risk of requiring higher level of care, requiring hospitalization, requiring emergency room visits. So it's not 100%. There have been people who have been fully vaccinated and still test positive, but their symptoms on whole tend to be mild. That being said, there are some people who have a weakened immune system, whose body might not generate that full response to the vaccine, that are still at increased risk of becoming sick. And that's why it's so important for those of us in the community to keep ourselves vaccinated and protected, because then we help protect the most vulnerable within our communities.
And there are persons that actually receive the vaccine and the booster. Can they still get COVID-19?
They can, and I wish the answer to that was no, but traditionally that has not been, and some people think that's an exception to the vaccine, or that indicates that the vaccine's not working. But if we think of something that a lot of people are familiar with, which is the flu vaccine, every year people have gotten the flu vaccine, and you can still get sick with the flu. That has never been 100%, but the chances of requiring hospitalization or dying from the flu are dramatically less should you get the vaccine. And we found that that's the same case with COVID, that yes, you can still get COVID. We wish it was 100%, but it's not. But the chances of getting very sick and requiring higher level of care are much decreased if you receive your vaccine.
What's the youngest person that can actually get COVID-19?
Yeah, unfortunately, there have been cases of newborns in the hospital, or moms COVID positive, having that exposure. So there really is no lower age limit of normal. So COVID, unfortunately, doesn't discriminate with age. So it could be from a newborn to, a 100-year-old patient, that anybody who has that exposure is at risk for getting the disease.
Let's talk about persons with disabilities. How important is it for them to actually look at the vaccine? I just remember we are actually calling different persons and making them aware of what we can offer them as far as resources, information. And many of them declined to get the vaccine because of things that were in the vaccine, or their immune system was too low. What can you say about that, doctor?
Yeah, I think there's a lot of misconceptions about vaccines. So when I'm talking to patients in general and patients with disabilities and their families, I'm really trying to understand what those fears are and what those misconceptions. The vaccine is recommended for all patients. There's very few medical contraindications to getting the vaccine, and most of the people who are declining the vaccine probably don't fit into those categories for which the vaccine is not recommended. So a lot of times they're not taking up the offer of the vaccine because of a fear, because they read something on the internet or someone told them something. So I think it is important to break down those misconceptions. Because a lot of people with disability, and we know there's a wide spectrum of people with disabilities and what other health problems they may have, But in general, they're a population that's at risk where the vaccine will do tremendous to decrease that risk of getting very ill with COVID.
Wonderful. Another thing that actually came up, I remember when COVID first came out, it was about COVID on surfaces. Do you know anything about that?
Yeah, there was a lot of attention. If you remember, bathrooms were all shut down. You know, everybody was panicked. People were leaving their mail out and putting gloves. You know, there is some transmission on fomites. Fomites is a word that we use for kind of surfaces, but it's not as great the route of transmission as that we used to think. So it can play a role. The importance of hand washing is always stressed, but it really is not the greatest route of transmission. The greatest route of transmission is still aerosolation of the virus and inhaling the virus and kind of that direct, you know, patient to person contact. So plays a role, but not as big as the fear when we didn't know so much that it played a role, that everybody was kind of panicked about everything in surfaces.
Wonderful. I remember everybody was on a mask hunt and just looking for, there's been so many different type of masks. Which one is the best one in your professional opinion?
Yeah, N95 masks are those very, you know, those tight-fitting sealed masks. They're the best because the 95 means that 95% of what you're exposed to is filtered through the mask. I happen to have my mask that I walked in here. These are not as good. You can see that there's gaps on the side here. How many times have we walked into places and people are wearing their masks like this, you know, or wearing the mask like this? And so these are effective at decreasing some of the transmission, but not as effective as a tight-fitting mask like an N95 mask. And there's been a push to try to distribute those better fitting, more protective masks to the general population because they were initially reserved for healthcare providers only. And now there's really a push to try to get them to other people and not healthcare providers and people in the community for that protection.
So if there's a viewer who's watching and you need some of those N95 masks, we can supply you with them if you would just give us a call at 610-376-0010. Ask for my direct extension, and that's extension 108, and we'd be more than happy to send you some out. Let's move forward and talk about ibuprofen. And I understand that there's a problem with that. It might be unsafe.
I think, again, those were one of the original, when the COVID virus came out and there was a lot we didn't know, there was a lot of people being instructed not to take ibuprofen when you're sick with COVID, but that hasn't necessarily bared out over time and bared out over research. So ibuprofen is safe to take with COVID. Tylenol is safe to take because it really becomes, for most patients, a symptomatic disease to treat, and ibuprofen can do a lot with the fever and the body aches and pains, and it is safe that you can take the ibuprofen.
Good. What are the different symptoms between flu and COVID-19? Are they basically the same, or do they have other
Yeah, there's
symptoms?
a little bit of an overlap they're both primarily respiratory viruses, so kind of cold, congestion, cough. The lack of taste and smell that we referenced earlier seemed to be really specific for COVID and not so common with flu. But a lot of times it has been hard to differentiate flu from COVID. Interestingly, when there was mask mandates in place and everybody was wearing masks, we didn't see a lot of flu. So last flu season, there was almost no flu in the community because everybody was wearing their masks to protect against COVID, and that led to decreased transmission of flu. This year, with some of the mask mandate lifted and more people having risk of exposure, we've actually seen flu come back. So it was kind of silenced a little last year, but it's always been out there. So we're starting to see some of the flu cases in Berks County and Pennsylvania were increasing this year as the decreased use of masks was occurring with COVID.
So it's necessary to get the flu shot, the COVID vaccine, the COVID booster. Do you think one's going to come up again for this fall that we might have to take another booster?
They just recently made a recommendation for those who were 50 and older, regardless of health problems, to get a booster of a booster. So 4 months after you got your last booster, it's now recommended to get a fourth vaccine or a booster. For those who are immunocompromised, that has already been in place. That the third shot is really to complete the primary series, and then the fourth shot was the booster. So for that subset of patients, it has always been recommended to get 4 COVID vaccines, and just recently released is everybody 50 and older. which at first they talked about the elderly until I found out that I'm in the 50 and older, so I'm in that group. So it really is 50 and older, regardless of comorbid or health problems, are now recommended to get a booster 4 months after your first booster.
Wow. I know that there was a time when doctors' offices were full of COVID-19 patients. If you have other regular appointments like physicals, checkup, that type of visit to the doctor, should you cancel those routine visits, or should you just go to the doctor when you're dealing with COVID symptoms?
Yeah, I think, what we've gone through this with stages. So initially during the height of COVID, when there was a lot of fear and a lot of unknown, we kind of delayed some of those preventive care visits and really did a lot of telemedicine and trying to keep people in their home and safe. We needed to bring people back in. So the chronic diseases didn't go away. The heart attacks, the diabetes, the asthma did not go away. And we needed to bring people back in because we recognized that we didn't want one pandemic to lead to another epidemic of preventable disease. Especially with children and childhood vaccinations, it was always very important that we continue to protect the youngest and the most vulnerable with their routine vaccinations and not keep them out of the office. But we've seen, and I think there's been a national trend, that people have delayed some of the preventive care. They delayed the mammogram, they've delayed the colon screening, and so it is a time now where we have to reach them back and bring them back into the office to be seen in person and get some of that preventive health taken care of.
Okay, so it is still to get those routine checkups and so forth.
Yeah, absolutely.
Very good. There's a word that everybody is using and more before than now, the flattening of the curve. What does that mean?
Well, a lot of times when you look at a pandemic, you see an increased rate of the cases and you see this peak of the curve, and you want to try to decrease the peak. So you're always going to get some cases, but you don't want that peak to be such that it overwhelms the healthcare system.
Okay.
So my roots are from New York, and I remember looking at the beginning of this pandemic in New York, and it was overwhelming the healthcare system.
Yes,
I mean, it was
I
clearly overwhelming providers and the ability to take care of people. And that was a peak we don't want to get back to. So when you talk about flattening the curve, you talk about decreasing that peak, decreasing community transmission, decreasing cases, so really not to overwhelm our healthcare system. And that's something that everybody has a role in. Because it wasn't just a peak of COVID. It was the people that were in trauma and who needed ICU beds and who had a need for high level of care or going to the emergency room. So COVID impacted all of those things. So as a community, if we decrease that overload in the healthcare system, decrease the curve, we can do a lot to help the healthcare system handle this going forward.
Wow, wow. Is it true that someone with COVID-19 symptoms can pass it on even if they're wearing a mask?
Especially if it's I gave that little bit of demo of that poorly fitting mask. So really the risk of transmitting the virus is decreased tremendously if you have an appropriate fitting, well-sealed mask. Real-time use of masks doesn't usually equal that. So most people are wearing the mask inappropriately, they're not good seals, so they were wearing the mask, but probably not appropriate. But if you look at healthcare settings and healthcare doctors and nurses who work in ICUs and with patients, with the appropriate protective equipment, they were doing well with preventing them getting infected. Their biggest risk became in their real life situations where they were with family or out in social situations. That's what put a lot of people at risk. But protective equipment and wearing it appropriately can decrease the risk tremendously.
Wow, wonderful. And I guess that played a part in them changing masks as we got further and further into the pandemic and numbers were high.
Right.
Things had to really change. Research was done and it had to change.
Yeah.
Everybody is dealing with this situation. It could be in a small piece or it could be gigantic, and that's mental health. I know you're not that type of doctor, but I'm sure you can speak on how people can kind of help themselves with mental health.
Yeah, and even though I'm not a psychiatrist, you can't be a family medicine physician and ignore the mental health issues of the patients that we're seeing. And there really has been a lot. There's the obviously physical part of COVID, but it has also coincided with the mental health pandemic. You have in our adolescents and our teenagers kind of being pulled from school and unable to socialize. You have people who have been suffering with addiction, who have struggled during this time. And so I think it's important to acknowledge the impact of not being able to socialize, of not being able to have your family support near you. So, and really pay attention to that, because it has absolutely impacted the mental health of our patients and our community during these last 2 years. It hasn't been easy for a lot of people, including some of the economic impact of it, the stress of work, the fears. All of those have done a lot to contribute to poor mental health of a lot of the patients we're seeing.
Can you tell any of our viewers, I know that some of them have been referred to therapists and psychiatrists, however, they're book solid. You can't get in. Are there just some simple things that persons can do to help with their mental health?
Yeah, I think that's probably a very individualized answer for the person, but you really have to look to see what resources you have within your community, within your peer group, within your family, and try to tap into those resources. And not be afraid to ask for help when more help is needed. You know, a lot of times, all of us can have sad days or days where we feel down, but you have to recognize when the way you're feeling is not that you're really struggling and coping, and ask for that additional help. And you know, your family physician, your primary care physician is a resource. There's school counselors for schools.
Yes.
There's a lot of employers have employment assistance programs.
Absolutely.
So you just really have to look and have a self kind of assessment of, are you doing okay? And if you're not doing okay, try to reach out to the resources that are out there.
Thank you so much. Let's switch gears and let's talk about who's responsible for reporting COVID statistics for Berks County.
There was just recently an update to the reporting requirements, so that any medical facility that's doing COVID testing does have to report the results of the lab-based, the PCR test, which is the kind of fancier of the test, the one that goes to a lab to result, and you still have to require both positive or negative for that. You also have to report there's another type of test that checks for the presence of the virus called the NAAT test. You have to report negative and positive for that. But you're no longer required to report antibody tests, whether positive, negative, or in between or equivocal. Those are no longer required. So the individual healthcare providers and the labs are required to report that to the state.
You brought up a good word, that antibody. I've heard people request that their antibodies be checked. Is that important?
I think it's important to understand why someone is asking for their antibodies to be tested, because a lot of people want to know whether or not their antibodies are protected, because they feel that might be a marker of immunity or protection. And so when a patient says, I want my antibodies tested, I always say, why? Because it's important to note that the antibody test does not indicate immunity and protection. So your antibody could be positive and you still be at risk for infection. You can get tested for antibody, but it does not signify immunity. And that's what I think a lot of people had a misconception about. And then there's a different antibody that comes positive after the vaccine. So a lot of people were getting vaccinated, getting an antibody test, and it was negative, and saying, see, I told you the vaccine doesn't work. But most of the antibody testing is specific to the antibody that becomes positive after that virus and natural infection. So it may be negative even if you were vaccinated, and that doesn't mean that the vaccine didn't work.
Wow. You have given a lot of information and a lot of food for thought. And I'm sure, like I said earlier, if you are looking for additional information concerning the COVID vaccine, you can contact Abilities in Motion at the Berks Community Health Center. Do you all have information concerning that?
We absolutely have information. We also have vaccine clinics available. So if you go to our website, berkscommunityhealthcenter.net, there's a special tab for COVID information, where there's patient information out there, a calendar of our vaccine clinic events. We also post information on our Facebook page. So you want to make sure that you're getting information from trusted information, and I do believe that we are a trusted source. The Centers for Disease Control is another place, but there's lots of some not so good information on the internet, so you want to make sure you're getting it from a reputable source when you're searching that information.
Sure. Anything else, lastly, you'd like to share with our audience? I know one of the things we always say is to be safe. Be safe and do the right thing concerning COVID-19. Continue to do that. Today is a beautiful day outside, but we want to remember we need to be safe because we heard about information in Philadelphia that the numbers are going up. In Washington, it's the same thing. But any last remarks you'd like to share, Doctor?
Yeah, I think just to reiterate that, we're really enjoying now having a little bit of a breath of fresh air, literally and figuratively with the spring weather, and enjoy that. Get outside, get some fresh air, exercise, and enjoy the fact that right now community transmission is low. But not forget, I wish COVID was over. I wish I was standing here saying COVID's over, or you made it, but I can't say that. And we have to be vigilant and really prepared that if the cases increase, that we have to start putting back some of those strategies to decrease the risk, both to ourselves and to our community.
Thank you so much. Like we said, and before we leave, education is very important, and definitely there are resources if you have questions or concerns. We're available. Berks Community Health Center is available. If you have questions, give us a call and we'd be more than happy to send you additional information. As we said early in our program, it's a pleasure to be with you today. Be safe and keep those masks around. You're going to need them. Have a great day, everyone.
Disabilities Issues and Updates on BCTV is supported by the Berks County Center for Independent Living, Abilities in Motion.